A bill that would legalize needle exchanges across Arizona is one step closer to becoming a reality, but that's not without some struggle to get the bill even heard.
Cronkite News reporter Bryce Newberry joins us live with what happened at the Capitol.
Yesterday, the House State and International Affairs Committee passed the bill unanimously. Arizona is one of 29 states that have not legalized syringe service programs, but advocates say a law like this could significantly help people who inject drugs.
We have a crisis situation here in the state of Arizona.
That crisis, people addicted to drugs.
And I don't think we have a comprehensive plan to tackle this issue.
State Representative Tony Rivero tackling the issue by reintroducing a bill to legalize needle exchange programs. A similar bill failed in the state Senate last year. The bill aims to reduce the spread of viral hepatitis and other bloodborne diseases, encourage individuals who inject drugs to enroll in evidence-based treatment, and reduce needle stick injuries to law enforcement officers.
We average 2 to 3 pricks a month on average in the city of Phoenix.
Sometimes those pricks come carrying a disease. Advocates say a bill like this could dramatically reduce cases of HIV and hepatitis C. Indiana legalized syringe services in 2015.
The lesson here is that public health policy would have saved their lives.
House Bill 2718 came in as a last-ditch effort to get the legislation heard. Rivero chairs the House State and International Affairs Committee. He erased a bill assigned to his committee and replaced the language with the needle exchange legislation. The original needle exchange bill that he wrote, 2148, was assigned to the Health and Human Services Committee, but the chair never put it on an agenda.
Considering that we are still smack dab in the middle of an opioid crisis and still looking for solutions, it's a little mind-boggling to me why this wasn't heard sooner and why it wasn't heard in the committee it was assigned to, but we know that we do have the support to keep this bill going.
Haley Coles organized speakers for Wednesday's hearing where state lawmakers heard testimony from nearly a dozen people, all in support of the bill. One of those speakers, Christopher Abert, leads a needle exchange in Indiana.
While efforts are being made to address and respond to the opioid epidemic and the HIV and hepatitis C epidemics, not enough is being done.
Representative Rivero says this bill could also legalize fentanyl testing strips here in Arizona. Last week, we reported on groups who hand out these strips, and these are the strips that a Johns Hopkins University study says could help reduce opioid overdose deaths, as they allow active drug users to test their illegal drugs for the presence of fentanyl. That's because fentanyl is being laced into drugs like heroin and OxyContin all over Arizona. But the strips fall under the drug paraphernalia law. Well, Representative Tony Rivero says he's familiar with the strips, and his bill could be an opportunity to legalize them as well.
I think it's a safety measure. I'm not sure if this piece of legislation is the right place to add it, but this is something that I will be talking to the people who are experts in this area.
Representative Rivero says the conversation is ongoing, and most pieces of major legislation in the state go through several rounds of changes before passing. Live in the Broadcast Center, Bryce Newberry, Cronkite News.